My name is Andrew Terris. I live in Halifax, Nova Scotia, Canada, but I grew up in the United States, mostly in the Northeast. Spent a lot of years living in Buffalo, New York. I've been back and forth across the US-Canadian border many, many times, and I finally immigrated to Canada in 1971. I've been working as an artist here since then, and interestingly enough, my father, Milton Terris, was an epidemiologist. He taught in medical schools in the United States, and when he retired, he started the Journal of Public Health Policy. So I'd like to comment on the Canadian healthcare system from 2 points of view. One as a user of the system, and another knowing something about some of the research that's been done on the differences between the American and the Canadian system. First of all, there's been a lot of, I think, mythology around the Canadian system, it's propaganda about the Canadian healthcare system. In my experience, working as an artist in Canada, I could actually afford to do that without worrying about healthcare because, of course, we have a single-payer universal healthcare system. So I never really had to worry about high health insurance bills because healthcare is covered here. In 2002, I had some serious medical problems, and I had prostate cancer. I was diagnosed, I had surgery, and in the end, that I don't know what that would cost in the States, but here, apart from some minor drug costs, the cost to me was zero. And it really is a matter of being able, the doctors are able to focus on healthcare and not on insurance. My wife has had a series of healthcare problems in recent years, which I'm sure if we were in the States would have cost us hundreds of thousands of dollars. And again, apart from the drug costs, which are not covered, they've cost us nothing. I think the bottom line here is that you have to really look at the difference between the United States and Canada in terms of the percentage of the gross domestic product which is taken up by healthcare. It's much lower in Canada. We have better health outcomes in terms of things like infant mortality and life expectancy. And best of all, we have universal coverage. There is nobody in Canada who is not getting health insurance and health care. And that is certainly a big difference from the United States. And when it comes to costs, I want to refer to my father's journal, where he published an article a number of years ago which compared the administrative costs of the private health insurance system in the States and the single-payer system that we have here in Canada. The Canadian system was 10 times more efficient. In other words, it costs 1/10 as much for our single-payer system as the private health care profit-driven system in the United States. And I think that speaks volumes about why our system is that much more efficient and effective. So for those who are in the United States who are, every healthcare system has problems, and it's not that we don't have ours, but from my point of view, sitting here north of the border, we have by far superior healthcare in Canada, and no one is left out. And that, to me, makes all the difference in the world.